Commonly, we think everything is migraine headache, but there's much more to that. You can have the fire starting from one thing, but then it goes all over. Same thing for the migraines. So, what about migraines? See, what happens is that many times the headaches are not classic migraines, they come daily. They can be from rebound headaches, such as from ibuprofen, but what if you have parascapular area pain starting, and from there it goes over the head, causes spasms, tightness, and you get throbbing headaches all over the head? This is a classic tension headaches, and many people consider that to be migraine. So what do you do for that? Well, if it is coming from this area, that is from T1, T2, T3 facet. So examine the patient. If they have T1 to 3 facet tenderness and the headache always comes from there when the episode begins, tell us to do thoracic facet blocks and then do regenerative medicine injections. And these are 2 injections, but if you want, you can combine that into one. That it is reliable that it comes from these joints. So if we do amniotic allograft, growth factors, stem cells, it'll make a world of difference for that area of pain. And if this is not getting painful, and then you adjust their strength, work on strength, posture, etc., their headaches will improve dramatically. So that's one way to address it. If the headaches are coming from the middle of the neck, in that case, you address the facet joints at that level, and by addressing the facet joints at that level, by amniotic allograft or stem cells or growth factors, it will really help the headaches. However, when you have the headaches that are coming from the auriculotemporal nerves, supratrochlear, supraorbital nerves, or the occipital, greater and lesser occipital nerves, third occipital nerve, and the greater auricular nerve, you can ask us to do nerve blocks with PRP. So PRP nerve blocks can be done. They will help in 2 out of 3 cases, whether it's for a week or a month or 6 months, we don't know. Time tells that usually, but we need time to figure that out. So more and more insurance companies are beginning to not cover many of these things. So you ask us to do the PRP nerve blocks there, and if the patient is seeing improvement, as long as the improvement is there, great. Otherwise, PRP dextrose or growth factor nerve blocks can make a difference. As long as you address the cervical spine and the neck, rest of it we can handle. So the key thing with the headaches is feel the neck. If the neck is causing the pain, it is cervicogenic headache. Fix the neck, most of the headache will go away. If the headaches are simply coming from supratrochlear, supraorbital nerves, auriculotemporal nerve, zygomatic branch, or the occipital nerves, we can do these selected nerve blocks with PRP or PRP and growth factors or dextrose, and they will make a lot of difference for most of these patients. So try them. If it needs to be repeated, it needs to be repeated, but if PRP alone helps for limited time, you can do the same thing with PRP with growth factors this time, but underlying postural abnormality needs to be fixed.